is Dr. Carol and our fellow classmates. We are Group 3 and our topic is tendinitis in nursing assistants, and the title for our topic is Loosen Up Your Muscle. Now I will introduce you with our group members. So I'm Nanjiba Morshid. With me I have Rachel, Latisha, Kamjun Kwan, Tham Chuan Z. And here are the topics that we will be covering: objectives, what is tendinitis, physiological changes, working nature, prevention, statistics, diagnosis, treatment, intervention, and conclusion. Now I'll be talking about the objectives. So our first objective is to spread awareness on nursing assistants that often go through work-related musculoskeletal disorders such as tendinitis. Besides that, nurse assistants are often overlooked as they are known to be the ones considered to be behind the scenes. However, they are often the ones that carries out the most work as compared to doctors. They tend to carry and move patients a lot. We as a group would like to shed some light on the nurses and appreciate them for their services by giving some in-depth information about the WMSD they might undergo, especially tendinitis. Now I'll be passing the time to Rachel. Thank you.
Thank you, Nanjiba. I'll be talking about tendinitis. Tendinitis is inflammation of the thick, fibrous cord that attach muscle to bones, which are called tendons. The condition causes pain and tenderness outside a joint. However, it is more common around shoulders, elbows, wrists, knees, and heels. Besides that, long-lasting tendon inflammation can cause a tendon to tear. Hence, a surgery is required. Now I'll pass it on to Jung Kwan to talk about the physiological changes.
So our tendons contain blood vessels and nerves. In normal condition, a tendon structure is similar to a fiber optic cable or a rod, with small collagen fibers arranged in bundles. This bonding reinforces the tendon and makes it stronger. However, tendinitis happens when a tendon swells and becomes inflamed due to repetitive activities, overuse, or aging. The patient may experience intensive pain when moving the inflamed part of muscle. It affects the function of the tendon over time and gets worse during forced movement if not being treated. Next slide, please. This is a 3D model of our hand. Tendons connect our muscles to bone. They are highly resistant to tearing, but are not stretchy. For example, in this model, we can see flexor digitorum superficialis, our largest, the extrinsic flexor of the forearm, and the white color part is our tendons that connect it to the bone. When the tendons inflame, they will become swollen, then limit our movement and causes intensive pain. Since the nurse's working nature requires them to manually move or lift the patients, the risk of getting WMSD will increase, especially when the patients are overweight or too heavy for their sizes to carry. Repetitive actions such as drawing blood also considered a risk factor of developing WMSD. According to Krishnan and his co-workers' research, the frequency of having musculoskeletal symptoms in any body regions was increased with age, lower education level, female gender, high BMI, job tenure, and lifestyle. That's all from me. Moving on to Latisha.
Thank you. Moving on, we would like to introduce 3 prevention methods to avoid developing tendinitis, especially in the nursing field. First, preparing muscles by strengthening it, such as taking more calcium supplements and so on. Second, stretching by moving your joints, maybe after exercise or after doing some heavy lifting. Make sure to warm up the muscles again. Second and last is easing up. Definitely start off by doing the breeze and easy work first and prevent overstraining the tendons, such as carrying a heavy patient and so on. When pain is felt, stop and maybe rest for 5 minutes before continuing. Next slide, please. Next, I would like to talk about the statistics. We took 3 examples of WMSD in medical or nursing field from 3 different locations. One is from from GMC Hospital Ajman, whereby from 147 nurses, approximately 39% of the nurses have had WMSD, at least once during their working period. Another study was conducted in Greece in the Greek hospital, whereby a total of 185 participants out of 250 were found to have at least one WMSD. Back 64.3%, neck 63.2%, and shoulders 58.4%. Pain were the most commonly known reported WMSDs. Last but not least, our home country Malaysia, where it was conducted at Hospital Sultan Abdul Halim, Sungai Petani, Kedah. Results were drawn from a total of 300 nurses. Almost all 97.3% of the nurses complained of having WMSD pain during the last 12 months. Body parts with the most pain were the lower back, 86.7%, ankles, 86.7% as well, neck, 86.0%, shoulders, 85%, lower legs, 84.7%, and upper back, 84.3%. Now I'll be passing on the treatment and diagnosis to be explained by Najib.
Thank you, Letitia. Now I'll be explaining the diagnosis and treatment. So as for its diagnosis, physical exam should be enough, such as checking the range of motion and posture and movement. And other than this, to be more sure, X-ray and other imaging tests can be done. So now I'll be talking about the treatment. Primarily to get rid of the pain, the treatment one can get at home is taking pain relieving medicines and enough rest, and also ice bath. But in longer run, they might seek for more help from doctors. Now for medication, they can take pain relievers like aspirin, ibuprofen, or acetaminophen, but some of them might cause stomach related issues. In that situation, seeking doctor's help is encouraged. They also might consider applying ointment to avoid side effects of oral drugs. They can also take steroid shot, but it only lasts for 3 months and eventually might cause tearing of tendons. So there's another way to avoid that issue. For that situation, your own blood sample will be taken, and following spinning methods, the platelets will be separated, and then the solution will be injected in the affected area, and this method is called platelet-rich plasma. So far, this is the most effective method. Physical therapy to these patients, as exercise can help to strengthen the muscle and tendon. Eccentric strengthening is an effective treatment for long-lasting tendon situation, as it puts tension on muscle and helps to lengthen the muscle. Other than that, other medical and surgical procedures like dry needling, which involves making small holes in the tendons with fine needle to revive tendon healing factors, is suggested. Surgery is suggested depending on the severity of tendon injury, but if it's torn away from bone, then it's a must need. Thank you, and now I'll pass the time to Chauncey.
Thank you, Najiba. Now I will be talking about the intervention. We have current intervention and past intervention. The solutions of current intervention are the lifting or transfer equipment and devices, ergonomic assessment and control, no-lift policies, and training and education. Next, as past intervention, human workers are asked to lift, move, and carry them. It can result in sprain and strain injuries. Injury risks for workers are greater when shifts are longer, breaks are shorter, or breaks given are too infrequent. Next slide, please. Now let's go a little bit deeper. First is the proposed intervention. Robots can help nurses to complete a wide variety of tasks, from drawing blood and lifting patients to patients' data modification and storage. AI and robotics are the future trends that will be applied in many fields, including medicine. Basu and his co-workers' article discussed the application of AI in the medical field and how AI can impact the field. Robots can also lift heavier items and patients compared to nurses. Besides that, routine work such as drawing blood, doing a physical examination, and drug administration are repetitive actions that can lead to developing WMSD in nurses. Other than that, the AI is able to analyze the inputs from the nurses and store those data. Next, Past success example of intervention in logistics are it lowers the risk of injury from repetitive motions and physical strains, and ergonomic concerns in the workplace. For example, awkward postures, heavy lifting, overexertion, repetitive motion, strains, and undue physical stress. So, using robotics and logistics can significantly reduce the chances of workers getting injured. Robotics can also increase the efficiency of the whole delivery process. In 2020, there were 24.9 thousand incidents where warehousing and storage workers were injured and had to take time off work to recover. 12,220 injuries involve sprains, strains, or tears, and approximately 1,500 cases were fractures. Next slide, please. Last is our conclusion. Work-related musculoskeletal disorders are a group of painful conditions that can affect our body. Our research topic, tendinitis, is a most common type of WMSD, especially among nursing assistants. The nature of the work of nursing assistants makes it easy for them to suffer from tendinitis. Therefore, our main ideas are bringing awareness to the public, appreciating the contribution of nursing assistants, and identifying response interventions to reduce the prevalence of WMSD. Besides, tendinitis can be diagnosed using a physical exam and rule out the cause of symptoms by imaging tests. Not only that, some treatments can also help the patient of WMSD to relieve pain and reduce irritation. So, in conclusion, prevention and intervention are important for those who are at high risk of tendinitis. It can help them to avoid the disease. Next slide, please. Here are our references, and thank you for watching, and hope you will like our presentation about tendinitis.
Now I will be talking about the objective. So I swear, I hate myself so much. Never mind, again. I did not change while treatment. Fuck my life. Can we do it again?